Hi, I'm Manish Arora. I'm Professor and Vice Chairman of Environmental Medicine and Climate Science at the Icahn School of Medicine at Mount Sinai. And I'm here with my colleague, Itai.
Hi, I'm Itai Kloog. I'm an exposure scientist and GIS specialist in the Department of Environmental Medicine and Climate Science at Mount Sinai.
Itai, so good to be here with you, and thanks for taking the time to speak with me. I know you're an expert in exposure science, but for those who are listening to us, could you take a few moments to describe what is exposure science?
Right. Exposure science looks at the relationship between human health and environmental contaminants. We look at the physical, the social, the chemical, the biological, the contaminants, and human health. We apply various techniques to look at exposures and reconstruct exposures. We use machine learning, AI, new technologies such as satellite remote sensing and drones. We look at the sources of exposures, for example, whether it's natural exposures from ashes, volcanic eruptions, dust storms, and whether it's human-made anthropogenic exposures, which could be related to traffic, point source emission from factories, and so on. And look at the origin of these exposures. For example, sandstorms can differentiate in terms of their health outcomes based on their trajectory. We use back trajectory techniques to look at sandstorms, whether they go over, for example, Egypt, where they have smelters and they can be coated with toxicants, versus natural sandstorms coming from Saudi Arabia, which are less adverse to human health. In addition, we use new methodologies to reconstruct residence level exposures using new techniques, and we share this information with our colleagues from environmental epidemiology, but not only. We share these exposure methods with other disciplines such as occupational health, ecology, agriculture, and other disciplines that use these new techniques.
Okay. So you're known the world over. In a way, you're famous for your work with NASA satellites. I think we'd love to know more about how you take a signal from a satellite that's so far away to inform people right down to the level of where they're living. So, go ahead.
So yes, so we've been collaborating with NASA for many years now. We have tight collaborations with the PIs of some of these huge NASA projects, such as MAIAC and MODIS. And NASA products gives us proxies to environmental exposures. For example, for air pollution, we use products from NASA that approximate the number of particles within a column. What we do is that we use these NASA products to calibrate with ground monitoring sensors. We use and develop statistical algorithms that allow us to reconstruct via these calibrations exposures at the residence level 25 years going backwards. So if you think about traditional ways of assigning exposure, you have one monitor in one location. For example, you take Boston, we have one EPA monitor station across the County Library in Harvard, and people living close to that monitor obviously get the correct air pollution exposure. People living far away, such as in Newton, obviously have different levels of exposure. They're much rural areas, they don't have traffic, they don't have factories near them. So what we do is, by applying our new statistical approaches and by incorporating the satellite data, we create millions of virtual stations across the US, so each person has its own monitoring station which can robustly reconstruct their exposures on a daily level going back 25 years.
That's amazing that I can, without having collected any data myself, know what I was experiencing 25 years ago. Now, is this only available for a part of the US? You mentioned Boston. How much of the US and how much of the globe have you mapped?
So luckily, satellites are global. So we definitely cover the whole of the US, but we also expand our models to other regions. We have models in India, we have models in Mexico, in Europe, and other parts. Unfortunately, it's not a one-size-fits-all. So in every region, we have to kind of deconstruct and reconstruct our models again to appropriate it for the specific region that we're interested in.
So, I've been talking to our other colleagues, Mayan, who talked about climate change. It seems that the work you're using would be so useful because you can go back in time and you're looking at, let's say, air pollution, but you're also measuring many other things. We'd love to hear your thought on how these technologies can be used by us to tackle climate change.
Right. So in a very similar method we developed, I think we were the first group, we developed methods of reconstructing climate exposure, temperature, humidity, going backwards in time. We apply very similar methods, but different algorithms to look and use satellite data that approximate the land surface temperature. And we calibrate that with air monitoring stations, allowing us at a very high resolution to reconstruct your air temperature and humidity exposures going backwards in time. We also have new algorithms to dynamically shift between region to region. Obviously in cities we have much more urban variability, we have the heat island effect in cities, and thus we need much finer detail in terms of your climate exposures. We have specific models to address that, allowing us to assign exposure at place of residence, at work, at home, at education areas, and reconstruct your exposures daily and even hourly in some cases, 25 years going backwards. So we can know, how your climate was at every day across your whole lifespan.
It's amazing because it sounds like science fiction. It sounds like something that you wouldn't think is possible, but you're doing it. You're doing it routinely. Just to conclude, I'd love to hear in your own words how all of this work helps, the patient in our clinics, how this contributes to precision environmental medicine.
That's a good question. We're putting a lot of effort in making this data accessible to clinicians and to public health workers. As part of the Mount Sinai CTSA initiative, we're creating a platform called Greener, where we will make all this data very easily accessible through the web page, and very easy to access tools where a clinician can come and search for an area and reconstruct exposures to air pollution, to climate change, to built environment exposures, specifically targeted at specific patients that he's treating.
That's amazing, and from what I know about working with you and the CTSA, you're making this available to colleagues all around America. Something that you have developed, it's over many decades, and now so many people can use it. So congratulations, and thank you for taking the time.
Thank you
to talk
very
to
much. Thank you.